Well, after we get a good exam, right? We decide at that point in time if we need to immobilize that or treat that at that point in time. That's what you're going to get from me. Okay. I worked with, football teams, youth football teams, by the way, too. We've worked with CrossFit people. We've worked with bodybuilders, okay, and everyday gym people there. So the fact that you're in the gym, that's exactly what I want. And I don't want you to be afraid of those injuries, but they're going to occur, okay? When you're deadlifting, okay, at some point in time, you're going to have some back pain from deadlifting and squatting at some point in time. And we're going to tell you what to do. Ice it, rest it, and then get the motion back in there so it doesn't keep reoccurring. So one example, shoulders, wrists, ankles, anywhere there's articular joints, there's alignment in there, okay? So sometimes I'll be treating your lower back, but I notice that your pelvis and your hip aren't rotating as well. I got knee pain on the outside, okay? Because it's one big biomechanical chain. When you throw that off, and now we're walking now, okay? But now I'm walking outside a little bit more out here. I'm putting more pressure on the lateral part. So we assess that. The acute gym injuries, we want to get that inflammation out pretty quick. Okay, you're probably not in my office that day. It's probably the third day when most inflammation occurs. We're going to use Russian stimulation, things like that. And most importantly, we talked about, again, ultrasound. Let's stimulate the healing now. Our fibroblasts, which equals collagen down the road. Another way of treating some as well for the sports injuries too is using a dry needling to increase hypertonicity, increase vascularity into the joints. Okay, and folks, there's plenty of research on that. You go to Java and all that. If you need that type of information, it's out there for you. If not, I'll provide it for you. Just send me a link. I'll send you a link once you reach out to me if you need that. Because I'm the same way. I want to know what's effective and who studied it. There's a lot of stuff we throw at the wall, that actually I wouldn't criticize or comment on it. But I would say that we'd stay more conventional with it. Electrostimulation, ultrasound, mechanical traction, and manipulation. And we have other doctors that do that. Doctors of osteopaths do spinal manipulations as well.